When you can't afford to go to the dentist, your teeth begin to turn colors. You lose them. They come out. Then you have pain, lots of pain. And that's the hard part. When you have lots of dental pain, it's horrible.
I don't have the money that I need to have my mouth fixed, and it's been like this for quite a while. And I really need some help with it. But it's hard to come by anyone who wants to put up money and do work for you when you don't have nothing to offer.
We are dealing with practitioners or providers that do come out of dental school with $300,000 plus of student loans. Dental hygienists who come out with $30,000, $40,000 worth of student loans.
I can brush my teeth with the softest toothbrush and my gums bleed very bad. So I can't use a lot of mouthwash. I can't use a lot of different things everyone else can use. And my mother's were the same way. So she had a choice, just like I had a choice, to either get them pulled, or in my case, mine fell out.
The nutrition and the food desert issue goes hand in hand with the oral health care issue, there's no doubt. If somebody has access to fresh, healthy fruits and vegetables, they're less likely to eat a diet that contributes to high levels of dental decay. When we did a needs assessment survey in Englewood, 60% of the respondents stated that they have pain in their teeth. Interestingly, 60% of that, in the same survey, 60% of the respondents said that they were satisfied with your oral health. Where there's an overlap there. You can't have 60% of the people who are in pain and 60% of the people who also say that they're satisfied. So unfortunately, a lot of the residents learned that pain is, they feel that pain is okay, that it's okay to have pain in your mouth, and it's not.
You can endure the pain, or like some people I know, they pull them themselves. Hey, a fifth of liquor and a pair of wire pliers do the trick.
When you're not able to chew your food properly, they tell you you cannot digest it, and you should chew it. And I wasn't able to do it. I could only gum it or do whatever I could with it, and what was left I disposed of. So it would always get into the system, and I end up anemic. So I don't know whether that's part of it or what, but
part of the problem here in the state of Illinois is the fact that the reimbursement rate is very low. Any dental office, in particular private office, runs at about a 70% overhead.
I mean, every patient that comes into the dental office has the Mirror, Explorer, all the disposables that go with the exam, x-rays, because you can't really see everything that goes on in the mouth. So all of these things cost a lot of money.
I mean, you have children who can't afford operations. You have adults who are walking around now who can't afford to go to doctors and dentists and different other places, but these are services that are needed inside and outside the community.
There are a lot of great clinics, a lot of great organizations that are working to meet the needs of the uninsured or the underinsured. However, they're at capacity. There's more needs than there are resources. People who don't have an aesthetically pleasing smile or can't speak without trying to cover up their mouth tend to not be able to get jobs, particularly in the service industry. So it's, again, a vicious cycle.
And this is a challenge of our department and our division to make sure that we try to come up with creative solutions to deal with these access to care issues. This year marks the 5 years where we need to assess our state oral health care again, to see exactly what was accomplished over the last 5 years and where we want to go. And also align those goals with the Healthy People 2020 initiatives to try to make sure that children and seniors and adults have access to oral care.
I'm the project director for the Chicago Community Oral Health Forum, which is a project of Heartland Health Outreach, which is part of Heartland Alliance. We work closely with community organizations, with the City of Chicago, the Department of Public Health, larger, the Illinois Department of Public Health, and a private-public partnership so that we can hopefully create a better system so that folks know how to access the oral health care system.